Hello, friends. Now, here we have Dr. George P. Jolly with us, who is a cardiology fellow from Loma Linda University Medical Center in Southern California. So, here in this session, we are fortunate to have him here. So, he'll be talking about the new COVID vaccine. And since it has been given to the healthcare workers in USA, he'll be talking about his experience, how the vaccine works. So, I'll be moving on to him. So, Dr. George P. Jolie, please take over and throw some light regarding the COVID vaccine and its nuances.
Thank you, Ajay. Thank you for introducing me to your followers and your YouTube family. I'm Ajay's cousin, and we were talking about this topic, casually last week. And I told him specifically about the COVID vaccine situation in the US. And currently, it's a good, scene in India because just yesterday, I think two vaccines got approved for emergency use, and I think it's necessary at this point to sort of throw some light into this particular topic and get my opinion about it. So I work with COVID patients in Southern California, and despite lockdowns and other efforts, the numbers are significantly growing up, and I think it's necessary that these vaccinations are taken seriously and properly, especially in the public health scenario. So right now in the US, we have two brands or types of vaccines, currently that are available. One is the Pfizer vaccine, and the other one is Moderna. So I received my vaccine on the 20th, and I was one of the fortunate few who got the vaccine in the first year. And just like everybody else, I was a little skeptic, maybe a little scared, I would say. But I was able to go through the data behind the vaccine production and the vaccine development, and all those things reassured me and gave me the confidence to go forward. So just as it was mentioned in other media, it's an mRNA-based vaccine, which means that mRNA, which is messenger RNA, produces proteins, and these proteins, which are surface antigens for these viruses, are the antibody triggers, and it's actually something that helps, in developing immunity in these patients. So let me share uh, my vaccine card. This is something that I got when I received my vaccine.
Yes.
Let's see.
George, can you please put it in a slideshow?
Yeah, sure. So this is actually the vaccine record card I received after receiving my vaccine on the 20th. So I received, it's an injection. I received on my left shoulder. You can choose wherever you want. So people try to go for their shoulder, or wherever there's a muscle. You could go for a muscular area. And first 24 hours, I had some mild, pain at the site, but nothing significant. I didn't have any fevers. I didn't have any allergic reaction or anything that people advertise in social media. I didn't have any complications or anything, and in a good way, I actually was getting a lot of feedback from the authorities. So there's actually a system where they actually track your symptoms after the vaccination through your mobile phone. So they keep track of your symptoms on a daily basis, and after the first week, on a weekly basis. And
Yeah, just one question
yeah.
regarding this. So for you, it was kind of okay. Were there any other cases where the people had some allergic reactions, or do they had to take any medication for that? Any such negative impacts for the vaccination?
So in my hospital so far, there was no serious allergic reaction reported for
Okay,
any
that
of
is
the
good.
staff that received. But I think there was one reported instance of an allergic reaction, like a serious allergic reaction, out of a few thousands. Like I would say, out of I think around close to a million might have received vaccines in the U.S. the first dose so far. I think one or two was reported in the initial week. So
Okay.
but nothing significant was mentioned in the media so far. So going back, so actually, in my hospital, most of the staff members have taken the first dose, and we are waiting for the second dose of this two-dose regimen. So I'll be receiving my second dose on the 10th of this month of January.
Okay.
So
So what's the time duration between the two doses?
so for Pfizer vaccine, they are saying 3 weeks, and for Moderna, I think they are saying 4 weeks. So anywhere between 3 to 4 weeks is the
Okay.
regimen they are currently saying. Uh,
Okay.
I
So within two doses, it will be done, right? Vaccine is done.
So yeah, so right now the regimen is a two-dose regimen. There is some talks about, we don't know how long the vaccine, the immunity that you develop after the vaccine dose stays in your system. So uh, you know at this point we don't think about a, a dose regimen that needs to be taken after the second dose, but at this point just two doses.
Okay. Good. Good. So please continue with
Yeah.
the
So
presentation.
yeah. So I think the main thing I would want to make sure everybody is aware about is just like I mentioned, it's a two-dose regimen. The first dose, even if you have, most of the people, most of the folks will develop some pain, some mild fevers, or even fatigue after the dose, but it's not something that needs to be, really be concerned about. And they actually recommend even receiving the second dose, even if you get those mild symptoms. Obviously, if the symptoms are something that needs, if it's more serious than that, you have to get medical attention right away. But these mild symptoms are not something that you need to be really scared about. And I think in our Indian system, I'm really glad we have two vaccines approved for emergency use. I think one of them is the AstraZeneca vaccine, and the other one is I think the Bharat Biotech, if I remember.
Yeah. Yeah.
So,
Yeah.
so these two vaccines are also I think the AstraZeneca had a pretty extensive trial showing an efficacy of 70%, which is great for a vaccine to begin with, and a very safe profile in terms of side effects, which is the main thing that we are concerned about. I
Mm-hmm.
think these things in the Indian context is amazing because the Pfizer and Moderna vaccine systems need a really robust cold chain system, which might be hard to maintain in India because they need a -40 to -70 degrees Celsius temperature to keep
Mm-hmm.
those vaccines in a stable state for transport.
Mm-hmm.
While the AstraZeneca and the Bharat Biotech ones don't need a very cold temperature for keeping them stable. So I think
But
for the
just one question. There were some concerns regarding the testing efficacy of this Bharat Biotech. Like, did they do enough testing before releasing it into the market? Do you have any such concerns compared to what it was there in US and that is there in India?
Right. So I think that's a good question. I really don't have a very clear answer to that question. The reason being, I'm not 100% sure if there was any detailed trial or data released for this biotech. To be honest, I know about AstraZeneca, which they had a detailed data released regarding the efficacy and side effect profile. But for the Bharat Biotech, I'm not 100% sure. I mean, I might be wrong, but I'm not 100% sure if there's a safety data that's available right at this point. So,
Okay.
since these vaccines were approved, at least the Bharat Biotech was approved yesterday, we are still at a state where a lot of clarification has to come from the government and the authorities about what exactly is the safety profile specifically for the Bharat Biotech. I can speak specific. I can speak about the AstraZeneca the vaccine. but not about the Bharat Biotech one. Yeah.
Okay. Okay then. Thank you for
Yeah.
that. And I have a question regarding the age group where this vaccine can be taken, and what about the amount of time will it have the effect? I mean, do we have to take any booster dose, maybe 5 years, 10 years down the line?
Mhm.
Is there anything like that?
That's a good question. So I think right at this point, we are focusing initially on healthcare workers and frontline workers to receive the vaccine, and people who are 65 and above in age. The reason being, these are the folks who are at high risk for developing complications. I mean, especially for the healthcare workers, they are the ones who have high risk of contracting the disease, and um, uh, those who are elder than 65, they are the ones who have high risk for developing complications. So we want these age groups and these population to receive the vaccine first, and after that, I think phase two will be those who are younger, and other population groups. So I think at this point of time, we will focus on this population, and then go for the rest of the population. And for the second question about the the duration for the immune response, I think that's still up to debate, because we don't have any long-term data regarding the immune response in people who have received this vaccine. There is always a possibility that booster dose might be needed in the future, but again, it's something that needs to be analyzed later, because we don't have any long-term data to look at and say that these vaccines have efficacy beyond
Hmm.
a certain time frame. So that
Okay.
has to be looked at. Yeah.
Okay, okay. So since we have certain constraints regarding the time, so we'll be moving forward like with the next question is regarding the new strain of this virus, because it has been reported in UK. So will it be okay? The vaccine that is being there at the market at present, will it be sufficient for the new strain? Can it tackle it?
That's also a great question, Ajay. So I think these new strains that have been reported on a daily basis from different parts of the world, they have definitely a high transmission rate, transmissibility based on their characteristics. But at least based on the recent information that's available from the authorities in the US, Dr. Fauci and some of the CDC officials, they in their opinion feel that the vaccine doesn't need to be modified, and they still feel that the vaccine should be efficacious to protect people from having from the infection. So
Mm,
we think that even the variants should be we should be able to get some degree of protection, or we should be able to get protection from the variants, uh, even with the vaccines that are currently available in the market.
okay, that is a very good news actually.
Yeah, yeah.
So I think the people who will be hearing it will be having a good feeling in their mind, because once the vaccine has come, do you think like even after the vaccine has come, the people have taken it? Do you think like there will be a complete normalcy to what it has happened earlier? The masks will be removed and all the civilian lives will be restored. Do you think that that thing can happen nowadays, or even afterwards? Also, do we have to wear the mask and all those things?
I think so. That's a good question. The main thing is for vaccine to be completely active, meaning in order to get your immune response to be active enough, it will take at least 2 to 3 weeks after receiving your second dose. And
Oh.
I think so that would mean that even the first line providers who are getting vaccines, right now, let's say in the US, who'll be getting their vaccine by the first week of January, they would get their effective immune response by the second or third week of January. And if you want to sort of extrapolate that to the whole population, let's say we are able to vaccinate a significant portion of the country by the end of this year, or by the mid of this year, I still feel we will still have to follow the basic safety measures that we were previously doing, including wearing masks, social distancing, and the hand hygiene techniques that we were previously doing. The vaccine has given us a tool to reduce the transmission and also reduce the severity of the infection, and maybe it will help with reducing the number of new cases, but it will not completely shut down the transmission cycle unless we reach a state where we have a particular, at least a critical number of people being vaccinated, which I think would probably take at least an year or more than a year time frame. So I
Mhm.
don't think we would be going back to a state of normalcy yet. But this is the first
Okay,
step.
so yeah, that's a very good word of caution, doctor. And like even just imagine in a country like India where there is a high density of population, and in states like Kerala or in West Bengal, like density of population is so high. So even after just say the vaccination has been done, and will if the theaters are all reopened, and when the fairs and all a festival season will come, so like people will have a general tendency to mingle like what it used to be maybe 1 year or 2 year before. So will it trigger an another round of maybe an a COVID like issue? Do you fear anything like that even after vaccination? Because in India, places like India, it is not that practical to control these festivals and fairs, and since the huge amount of floating population is there, so, do you fear any such kind of a trigger of a next cycle of COVID even after vaccination if these precautions are not taken into consideration?
I think that's something which we have to make sure everybody is aware about, because um, in a country like India with the vastness and the population density that you're mentioning, it's really tough to get social distancing and other measures implemented. But I think um, it's even more important that people are aware about the vaccine options and they take them, so that at least we could initiate some form of immunity in the population, because we as a population have will have a really tough time controlling it, especially in the next few years or few months to begin with. To have some form of response to come in this population. So I think it will be really tough, especially in the Indian scenario. So I think the main focus has to be implementing social distancing, and at least at some form, people do continue their precautionary measures, including wearing masks. So I think vaccines or any all these measures are always going to be synergistic, and it's more like you have to do these things all together to break the cycle and go forward. So in Indian scenario, it's not looking great in my opinion, but I think it's always better to be cautious in these scenarios.
Okay, thank you, doctor. So, like the time is almost done now. So, if you can conclude it, we can conclude this discussion.
Sure.
Thank you for your time. So,
Thank you, Ajay.
you do you need to add any more points regarding this, especially what you have to the suggestion or kind of thing that you want to talk to the general public, even
I
after
think
vaccination, what they should do, like.
I think in the Indian scenario, I would urge people to take this vaccination and the vaccine initiative seriously. I want the public to understand the reasons and the safety behind each of these vaccines, and have support this cause, so that the population and the government can reach a state of normalcy at the earliest, hopefully in the near future. And
Okay.
hopefully, I could travel and we could travel to
Mhm.
different parts of the world, and have some form of pre 2019 kind of a scenario.
Okay. So thank you, doctor.
Thank
Thank
you.
you for your time.
Thank you, Ajay.
Thank you for talking to me. I hope this voice will reach more and more people in India, because India is also going towards a mass immunization program, maybe the biggest in its history.
True.
And
True.
thank you for your time. Thank you for talking to me. And I hope this voice will reach more and more hearts.
Of course.
Thank you, doctor. Okay, then signing off. Bye.
Bye, Ajay.